Tissue healing is a process, and the body's not always great at getting back to 100% quality. And with some big tendon and ligament injuries especially, it doesn't always get there. Let's say it gets 90% instead of 100 or 95%. Well, that's a pretty good healing job. Sometimes it really kind of crash courses it. It's kind of that Uncle Bob who comes over to help you fix a project, gets it done enough, and it'll work. But if you keep overloading that area, it's going to break again. The same thing happens with tendons. We see that a lot around the knee. From years of walking around, running, jumping, a combination of sports and activities, you've created a lot of areas that have created damage. We've had some good healing and repair, but we've also had a lot of these cheap patches in places. And those cheap patches get you by, but they're also the easiest to flare up. So now if you start a new sport, a new activity, or the flip side is get out of shape and really aren't doing much, you lose muscle mass, you lose strength, you lose stability, and now when you start moving again, you're going to overload those zones because there's less muscle to protect it. It also doesn't move and stabilize as well. So that combination then puts more stress into that bad patch area, flaring it right back up. So with treatments, yes, we're trying to get the pain down as quickly as we can, but we also have to turn on the mechanism for healing. And that's why we like some of the soft tissue treatments of Graston or Shockwave, because A, they shut down the inflammatory pathways, the excessive ones. They're also then going to turn on the things that help healing. We increase blood vessel development into areas. So that's part of healing. If we can get more blood vessels, bringing more nutrients, you can get better healing. We're going to turn on the cells that help repair tendons. Those little tenocytes or fibroblasts help activate, help lay down the collagen. So increasing the collagen synthesis or building more of the quality structural elements in the area, not just in the area, but in the organized fashion it wants, in the direction of force. It's going to help pull up a lot of that bad scar tissue or collagen that's gotten formed. We're going to turn on the protein synthesis to help with tissue repair and enhance the other growth factors that are going to make this a stronger tendon. And by really ramping this process up, we can help speed the healing process. We're going to shorten the injury repair mechanism from months down to weeks. So you think if you bring 10 handyman into an area and get them going, they're going to get the job a lot faster than 2. Same thing with those tendons around the knee. So the combinations of treatments to help not just the strength, endurance, flexibility, but enhancing the soft tissue, the thing that's going to help speed up your overall repair and make a better quality healing so you have less injuries in the future.